Hi, everyone, and welcome to After the Diagnosis, a webinar series presented by the Neuroscience Family Advisory Council at Boston Children's Hospital. In this webinar series, we'll be talking to patients and providers about diagnoses that we face and giving a completely different perspective on them. Today, in our inaugural episode, we're going to be getting into traumatic brain injury. We have 3 different participants, each with a different background, and we're super excited to get started. So let's start by introducing our participants. I'm happy to go first. My name is Dylan Kirsch. I am a junior now at Cornell University in upstate New York, majoring in industrial and labor relations with a minor in health policy. It feels like a mouthful, but I was introduced to Boston Children's after I had my own traumatic brain injury in the summer of 2019. I was at swim practice when I had a fainting episode and my head took the impact. And I was so fortunate to be surrounded by incredible providers like Stephanie here, who was able to get me back up on my feet and back to a normal life, which I just could not be more thankful of. Since then, I thought I wanted to be a lawyer, and then I realized that neurosurgery was probably a better fit for me. And I'm pursuing medical school in the hopes that I can help others. It's been a wild ride. I mean, the past 4-ish years now have been a blur, but in the best way possible. And I'm really excited to share my experience today here with everyone. Stephanie, do you want to go next?
Sure. So I am the brain injury nurse practitioner. This is my second go at children. So I actually started my career here back in 2006. I was an emergency department nurse. And then I moved over to orthopedics for a while. I actually left children's for, I think it was like 4 or 5 years, and came back to my first home. And I've been in the Brain Injury Center now since 2017. And I've been running the Brain Injury Center program and been the nurse practitioner, and trying to develop the center and also alter how we can impact the hospital, how all of our brain injured kids are cared for, and kind of try to connect all of our providers that take care of kids with brain injury, and just make sure that we're all doing things together, and that we're connecting our researchers and our clinicians in all sorts of different ways. So that's kind of a little bit of history of how I got here. And my role as the brain injury NP is I'm lucky to meet people like Dylan, and I am lucky to meet kids from when they're in the ICU. I remember meeting your mom when you were still not really ready to meet me. And I try and provide a little hope to parents. Like, I'm here. We're gonna do this. We're gonna do this together. It's gonna be okay. There's gonna be another side. We're gonna get there. And I get to see kids from their injury all the way to the other side when they're back to their sports, back to the things they love. And that's what I like to do. I like to get kids back to their love, back to their sport, back to what they want to do, back to school, back to whatever it is. And so I'm lucky to see kids through that whole continuum.
It's a very special role, and one that I could not have done without. Well, thank you. Dick, talk to us. Introduce yourself.
So it's really, thank you very much for letting me be a part of this, Dylan and Stephanie. I am the EVP of Hospital Operations and the Chief Culture Officer at Boston Children's Hospital. And Dylan, also a Cornell, I'm a Cornell alum. You're still making your way through those beautiful gorges and hills and by Lake Cayuga up there in Ithaca, New York. And I hope you're enjoying yourself. But that connection, we didn't know about that, I don't think, until we actually got the chance to meet with each other, and maybe explaining how I ended up being the Chief Culture Officer along with my operational responsibilities. And Dylan, this will resonate with you. I was in the School of Human Ecology at Cornell, right? So I had a very strong sense that I wanted to be involved in an administrative way in the healthcare world around the lives of children and trying to make their lives better and the world a better place. And I've worked in pediatric institutions now for my entire career. spending 15 years at Colorado Children's, and now I'm in my 15th year here at Boston Children's. And so I really am flattered to be able to be a part of this. Stephanie, Dylan, and I are going to pepper you with questions today as we try to learn a little bit about this and share some information. I think some important facts for people that have either gone through traumatic brain injuries or are interested in the field themselves. So, and you might notice in my background, I have some athletic pictures there of Muhammad Ali, Joe Frazier, and Dick Butkus, who I wondered if it was okay for me to have those today. But sports are a part of our lives and have been an important part of my life. And I shared some things that have happened to myself and to my children as far as some of these injuries go as well. So we'll have the chance to talk a little bit about that. But I am going to be speaking in layman's terms and asking questions that I hope you don't find to be too silly, Stephanie, or too basic as we go through our conversation today, but I'm really looking forward to this. And Dylan, I want to thank you as somebody who's still in college, who has gone through this, this challenge in your life. You became involved with Boston Children's. You got to work, and Stephanie got to work with you. Obviously, she had an amazing impact on your life. That you're here as a young person who is doing what you're doing, trying to shed the light on these kinds of injuries and what BCH can offer, and how parents and patients and loved ones and support systems can help deal with these kinds of injuries. So a tremendous thank you to you, Dylan, as we get started today.
I couldn't have done it without an incredible team, and we just take it day by day, and that's all you can do. It's just one foot in front of the other, trying to make a difference as you go. So
there you go. Stephanie, though, I do want to know, did you happen to go to Cornell too, so we could make this a triple header?
I did not. I went to Boston University, right down the street.
Right. Well, there you go. The Go Terriers, great hockey team at BU, and my mother is a BU grad. She was there. She's 96 years old, and she went there when there weren't a whole lot of women going to BU. So BU has a special place in my heart as well. So great to hear. And can we just hop right into some questions? Would that be okay?
Let's kick it off. Let's do it. Yeah.
All right. So we'll start off with a basic one, Stephanie, sort of what they call a softball in the field, if that's okay. Speaking about sports, can you tell us a little bit more about what exactly is a traumatic brain injury? We hear words like concussions and TBI and subdural hematomas and CTE and those kinds of acronyms that get used or descriptors, but I'm assuming there are all kinds of different variations of things that allow you to categorize the injuries themselves and that help set the treatment plans and recovery plans for people. So can you help us out a little bit with some of the basics?
Yeah. So, traumatic brain injury is just an overarching term. And actually, we consider concussion a type of traumatic brain injury. So it's a mild traumatic brain injury. And actually, when you look at all traumatic brain injuries, about 85%-ish of TBIs or traumatic brain injuries are concussion. So the majority of injuries are concussion. That kind of makes sense, right? It's the most mild form. It's the least impactful injury. So most of our money and most of the research out there is in concussion, right? It's the most common injury. It's the least significant. So thus, that's what we know most about. So most of the research you hear and the words we hear most about head injuries are concussions. When we, from the pathophysiology, or what we really see when we have a kid that comes in, a concussion is what we consider like a functional injury. There's nothing structurally wrong with the brain. So there is nothing we see on any imaging. A CT scan or an MRI are all going to be normal in a concussion. It's an injury with how the brain is working. When we talk about like a subdural or an epidural, a skull fracture, those are all more significant traumatic brain injuries, although they can still be mild TBIs. And those are more structural injuries. So we do see those on CTs. CT is usually the first line of imaging we do in the emergency department. It's quick, It's easily accessible, and most emergency departments are able to get a CT scan and you can see all that. So overall, most injuries are mild. The majority of injuries are mild. More severe injuries can be multiple types of things. So you can have different types of bleeding or different types of fractures, multiple fractures, subdurals, epidurals, subarachnoids. Those are all different types of bleeding in the brain.
Okay. All
So you
right.
kind of have fractures, you have bleeding, and then you have this kind of functional injury, which is concussion.
Got it.
We also kind of throw around concussion a lot, even when you have a significant TBI, because we talk about concussion symptoms, which are what you feel and how you recover. So even if you have, say, a skull fracture and you're recovering from that, you may have what we call concussion symptoms. So you'll still hear that word even when you have a really significant injury, if that makes sense.
Yes, it does. And Stephanie, before we hop to Dylan to ask a question, just to build on that a little bit, in your clinical role, what's the age range of patients that you see? And I would imagine there are thousands of ways that people can get a concussion or a traumatic brain injury, but are there some common things that happen among the younger patients that you care for?
Definitely. So I see all ages, from newborns all the way to older adolescents. I mean, we really,
Dylan, an older adolescent. Dylan, do you count as an older adolescent?
I think I was 17 when I came in.
Okay, there you go.
Pretty old.
Yeah, I mean, even into, I think, most trauma patients are kind of, unless they have a existing like history with us, if they're over 18, they'll go to an outside like adult hospital, but every once in a while we'll get someone that's like 19, 20. But usually that's kind of the upper end. But yeah, there's definitely different mechanisms you see based on age. So the babies are usually falls, most of them. Unfortunately, sometimes we see inflicted injuries on the babies. But I'd say the majority are falls. So fall off a bed, off a changing table, dropped babies. So somebody falls down the stairs and the baby falls out of parents' arms.
What are the symptoms in babies when they have a concussion? Because they can't tell us. So how would a patient, a parent or a caregiver maybe suspect that there's a concussion that's happened in a child?
So usually, so often the parents will know that the baby isn't acting right, they're sleepy, they're vomiting, or they'll see like a big swollen area on the side of the head. Sometimes they can have seizures immediately after. In an infant that has a significant fall, you pretty much should always bring them in to get checked if they have a significant injury and they have a fall. But afterward, when we talk about older kids having headaches and dizziness and all that, I'll tell you, my babies do really well. They kind of act themselves pretty quickly. Do they have headaches? I don't know. Like you said, they can't tell us.
Right.
But most of them seem to be kind of back to themselves really, really quickly. Even like the 2-3-year-olds that could say complain or kind of be out of it, they act pretty normally really quickly. So I do think the little ones tend to get back to themselves quicker than the older kids.
Okay, so Dylan, you might have noticed that I asked a whole bunch of questions when I was only supposed to ask one. So I'm going to defer to you now, if that's okay.
I love it. No, and I just wanted to say, I think one of the biggest questions that my friends, family, everyone had after my injury was kind of like, to your point, right? Like, so did you have a concussion or did you not? Because to Stephanie's point, like I had these structural imaging abnormalities. I did have bleeding. I did have bruising. And it was the first question was like, wait, so did you have a concussion or did you surpass a concussion? Kind of what happened? And the way that I answered that was, okay, it was a worse form of a concussion, but that's not to say that, the symptoms are drastically different. When people come up to me and say, I've had 6 concussions, it must be nothing like yours. Well, it actually is. Like we actually deal with a lot of the same symptoms. And there's no use for comparison of just because I had bleeding and some bruising doesn't mean that, we have like these different symptoms or experiences that kind of push us apart. And I think, just from my experience, one of those biggest things is to understand that concussion is a traumatic brain injury, right? It's a sliding scale. There is no use in saying how different it is, because it's not, right? Damage to your brain is still damage to your brain. Yeah. So let's then talk about current guidelines for care, right? So we've always been taught that, like, I remember growing up that, you should be in a dark room, no screens, like you just sit there and sleep and let the brain recover. But we know that, like, all brain injuries are different, but in general, Stephanie, like, is this still the best case scenario? It's like, have guidelines completely changed? Because from my understanding, they have.
Yeah, so, you're right, probably, certainly, I don't know how long ago guidelines changed, but certainly years ago, that was the advice. Like, they called it cocoon therapy. And it was like, quiet, calm, put people in a dark room, quiet everything down, let the brain just rest. And we've learned that that's not good for kids. So certainly the research on concussion, so true concussion, is that that's not helpful. And, there has been some clear research studies that show that light aerobic exercise, as after kids are back to school, so once you're tolerating some mild school, so not symptom free, but like once you're able to get to school and we know that things are starting to get a little bit better, light aerobic exercise actually makes symptoms improve faster than not. And this was a great study out of Buffalo by Dr. John Leddy. And it really kind of, I think, helped pique people's interest in how we treat kids. I also really encourage people to get back to school. I think a lot of parents are hesitant to send their kids back to school. Let's remember what some of the signs of depression are, right? Fatigue, depression, like symptoms, they can mirror concussion symptoms. So you can kind of get like a headache, you can get this fatigue, you can get this like withdrawn attitude. So like you take this child out of their regular environment, you take them out of their friend circle, you put them in a dark room or you put them in their room and you say like, don't do anything. And now they might get depressed. You also have taken away the sport probably that they love if they're an athlete, which I like to say, I don't get a ton of book readers that get head injuries sometimes, but most of them are athletic or active children. And you can also kind of make things worse by not giving them structure, not giving routine. The other thing is half of them sit in front of a video game because parents are working or busy and they don't know what to do. Sitting in front of a screen for 6 hours a day is not good for them either. So I say to kids, like, listen, if you can't pay attention all day, that's okay. Like, go to school, see your friends, right? Go, if you can't sit in the lunchroom because it's loud, that's all right. Let's find another place for you to go for lunch. But if you can absorb 10% of your math class, it's better than zero, right? If you can get some socialization, you're going to feel better. If you can just get through half of your school day, that's better than zero. Like, let's see what we can do for you. I think there's just so much social pieces that is positive to school and so much routine that can be helpful. So yeah, I do think getting kids back to things sooner is really important. Now, that said, on the screen time part, up until recently, there really was no research on screens. So we recently had a new study come out, and Dr. Rebecca Mannix was a part of it, which showed that within the first 3 days after injury, it looked at kids with concussion and basically said, took 2 groups and said, please don't do any screen time for the first 3 days. And the other group said, go ahead, do whatever you want. And knowing that some of these kids, even though they were told not to, right, they still did some screen time, but they also had to log it. So over the first 3 days, the one group did about 2 hours of screen time versus the other group had about 10 hours of screen time. And actually the kids that had more screen time recovered slower than the kids that did not. So we do know, at least in that very initial period, watching tons of TV, sitting and staring at your phone could increase the length of time it takes you to get better. And it kind of makes sense because most kids will tell you, hey, if I stare at my phone, my headache gets worse, or I get more dizzy, or I don't feel good. So
That happens in adults too.
also true, right?
Yes.
So this all kind of makes sense. So I do say to kids now, like, first 2 to 3 days, probably best that you're not staring at your screen. If you do want to like check in with your friends, like 10 minutes and then put it away. I get the social aspect, but like text your friend and then put it down. Don't stare at and doom scroll through TikTok or Snapchat. It's just not worth it right now. Put it away for a little bit.
So Stephanie, you've kind of hit on the, oh, sorry, Dylan, did you have another question?
Yeah. I think, no, just the biggest part for me that was just instrumental in getting me back. I was a swimmer at the time of my accident, and that's where all my friends were. I was on a gap year in between high school and college, and that's where all my friends were. And I think, getting back and doing light aerobic exercise, it was like, okay, can I just swim? I mean, this was somebody who could swim for like 2 hours, and it was like, can I swim for 5 minutes? And then can we do 10 minutes? And just to be surrounded, by my friends cheering me on and saying like, oh my God, like I'm back in the pool. It did wonders. It pushed my recovery, I think, so much quicker. Just the fact that I could be back in a somewhat normal situation, that I was not only exercising, but also being around the people that supported me the most and had been there since day one. So I like to everything Stephanie just said. I think it's so important that we get kids back to what they love, whether that's school, whether that's their sport. You got to get them back to what's normal, but to the point where it's healthy for them, right? So it's kind of finding that fine balance between what is healthy and not pushing too hard, and also saying, normal life is waiting. Like this is we're ready to go back as soon as you are.
Great. So Stephanie, you hit on rehab a lot during that conversation, but are your rehab plans for patients, are they individualized based on the context of their lives and their injury and where they are in their life and their activities that they like to get to? And you've also touched on this, it's both physical and cognitive as far as a rehab plan goes, correct?
Yeah, so rehab is so individualized, and certainly not everybody has like kind of formal rehab. So for somebody that has a very severe injury, certainly they are getting a formalized rehabilitation plan there. They may spend weeks in rehab and then have a very formal outpatient program. But aside from those kids, most people aren't getting kind of that full picture. And it's very, like you said, it's very dependent. So somebody that's having a lot of dizziness or difficulty with balance, I'm going to get them PT. So physical therapy can really help with that. We have to think about vestibular. So the vestibular system can get really knocked out of whack, kind of when you hit your head. You forget that that's right on in there. And our friends from otolaryngology here can really help with that. But we also have physical therapists that are really trained in helping kind of reset the vestibular system here. So I often will refer my patients there. And then just in general, PT is great for athletes, right? I have athletes that will come in and I will do just a balance test with them, and they're terrible. And then the parents are like, oh, they don't have good balance. I'm like, but you're like a soccer player. Like, how do you kick? Like, you're supposed to be on one foot when you're kicking your field, like your goals, right? Like you're kicking a penalty kick and you need to stand on one foot. You have terrible balance. Don't you think it would help you to have better balance? Let's go do some PT. That also helps these really athletic kids that are like itching to go back, because they can help get that rehab plan in place and make it really formalized. Sometimes these kids that are like gung-ho about like being back, and I'm sure you can imagine, push themselves too quickly. Yeah. So physical therapy can really help us guide that in a really safe way. We talk a lot about what I call sub-symptom threshold activity. So this is a clear activity guideline, but I also use this and I talk about this with kids with everything they do. So I talk about this with school. I talk about this with TV and all the things they do. And what I explain is we have this threshold that we sit at where we can tolerate things, right? So think about it as like, I can tolerate this much school activity, okay? And when I go above this, I get a headache. We want to keep you right here, or even right here. I don't want you up here. Because once you get like a headache that's like a 10, there's no coming back from that for a while. You're out. You're out for the day, right? You're home. But if you can get a headache of a 3 and you go rest in the nurse's office because you're like, hit my threshold, I'm gonna go lay down for a minute. Usually that headache goes back down and you can head back into class.
Okay.
Same thing with activity, right? So I'm okay with you getting a little bit of your symptom, and that's where I want you to stay. I don't want you to keep pushing it past that. And I explain this also sometimes like kind of like a marathoner, right? You're not going to get better if you don't hit that threshold every time. So every time you go out, you want to keep going until you hit that threshold of where you feel like you can go. And then we back off a little bit, and that's okay. And the next time you're going to be able to go further and further. And that's how we get better. So PT really helps kids find that threshold and push it without going too far. Do it in a safe way.
Part B to my question again, Dylan. Sorry, Stephanie. I'm assuming there is a big range here, but how long do symptoms linger in patients? And is there a place where you say, well, we should go back in and do some more evaluation if certain kinds of symptoms are lingering for quote unquote too long?
So in adults, it's normal for symptoms to not last longer than 2 weeks. With kids, we give it about 4 weeks. Most children are better within 4 weeks of concussion, okay? When we are past, now this is concussion. When you kind of get past 4 weeks, now we have to think about like, okay, are you getting better? And are we just have like a little bit of a lingering symptom, but we're mostly there? Or are we really not getting better? And then do we need to investigate further? And it also depends on the severity of your injury. Some kids with a really severe TBI, they may just have deficits or lingering symptoms, right? You damage the brain and you may never recover parts of that. Like you may have a tight heel cord because that was part of the damage that was done. I do have kids that have had severe brain injuries that just have headaches. They're not all the time, they're tolerable, but they do have headaches. They never really did before. But certainly, having symptoms for up to a month is kind of normal for concussion, but anything beyond that certainly would require further evaluation.
Thank you.
Yeah, Dick, I always think about when somebody asks how long it took me to recover, I always think about the acute symptoms and the symptoms that probably will never go away. And the acute symptoms meaning I've been really lucky in the sense that I haven't had headaches. Fatigue has kind of gone away. Those really initial impact symptoms went away after about, I would say, 2 months. But the long-term ones, unfortunately, because it was a frontal lobe injury, I struggle with my concentration. I struggle with my memory. I struggle with higher cognitive functions, which we've done a bunch of testing for. And I'm, again, very thankful for the team at Children's for. But I also don't have a sense of smell anymore, which is really weird, bizarre. Exactly. But it's just the way it is. And I think what's so interesting is that, and we touch on this, but no brain injury is the same, right? You can come in with the same presentation, the same impact, the same, imaging down to the T, and a kid might have totally different symptoms. It's so unpredictable in that sense that I think that's the hardest part about treating children with brain injury is that, one kid comes in looking really severe and comes out great. And then another kid comes in with a concussion because they bumped their head playing soccer and deals with post-concussive symptoms for years, right? And we don't have a reason necessarily why. And I think that's what's so difficult about it. I think I've learned to just say, I've learned to chalk it up and say, okay, you know what, this is my new normal now, and that's okay. And that's something that I've learned to deal with and understand over the last 4 years. But my last point is the idea of PT, I think, was just beyond important for me in my recovery. Danielle Barnack, who was the brain injury PT when I was going through it, literally became like a mother to me. She was like, I need to know what time you're going to bed. I need to know like how much screen time. I need you to I need your heart rate for when you practice. Like, she took it upon herself and me and all of her patients to make sure that they were recovering the best they could, right? And she literally became like a mother to me. And I again, like, so thankful for her, because I would not be swimming, I would not be rowing now without her, without everyone's help. So it's individualized, right? Nobody goes through it the same. And I think that's what makes it so interesting, but also so devastating in a way that, you know, we just don't know. And all we can do is give kids the best chance that we can to get back to where they were before.
Fair enough.
I think you said something really important too, that you struggle with too. We often see those physical symptoms in the very first part, which is the headache and the dizziness and like the difficulty with sensitivity to light. And actually, you see emotional symptoms much later. So often people will start complaining of that piece a little bit further down the line. So it's funny how as the physical symptoms get better, people start seeing kind of more of an emotional side effect, and cognitive symptoms can kind of linger throughout, but I think people start noticing them a little bit further down the line as these physical symptoms go away. So, right, as you're not having that headache anymore, you start noticing that concentration a bit more, right? When that headache's not bothering you, you're like, I am having trouble with my memory or paying attention in class.
Yeah.
So it certainly perhaps is always there, but there definitely is an ebb and flow of which symptoms are bothering you the most.
Totally. So I know we touched on this before, but getting back to school, how are you, Stephanie, if at all, coordinating care and return to activities with schools themselves? Is this still completely driven by the parents and the kids, or is this, you know, kind of a multidisciplinary, multi-site effort?
So, you know, it's again individualized. Sometimes we involve some of the rehab teams. So if OT or speech are involved, they can definitely be teams that are helping with that process. Neuropsychology often can get involved when we have kids that are struggling and help us with our plans for return to school. When kids are having difficulty concentrating, they can give us some, or having difficulty with memory, they can give us some tools to help with their return to school. Parents that want more help for school, they can sign releases, and I can speak with guidance counselors or school nurses. And those that don't, you know, I do provide notes to families with kind of just a general set of guidelines. One of the things that I feel very strongly about is not doing a ton of makeup work. When you get to the point of like math, right? You got high school math, you do have a point, like you have this cumulative point, right? Like if you didn't do this, you really can't do this, but you don't have to do 100 of these problems to do this, right? You have to understand this concept, but you don't have to do all of that work. So, you know, I try to explain in my notes to the school that like, it's unfair to expect a kid who can't do a ton of work anyhow to do all the work they missed and now try to catch up and continue to do work. So we try to excuse the work that doesn't matter and really limit the work to show understanding, make sure they get what they need to get, but not expect more than that of them. Making sure, you know, you can't expect a kid you can't like miss the first half of a book and get the second half, right? But there is certain stuff, like you don't have to make up a vocab quiz, right? Like really, that's something we can push aside. So trying to weigh what's most important.
So Stephanie, you've hit on this several times, but how do you counsel patients and families about the emotional aspects and effects of TBI, and what they can expect and how to deal with them as they progress through their rehab?
Yeah, so a lot of times, so one of the few things I do tell parents is like, it can get really frustrating, especially as a parent, right? When your kid is acting out, a lot of these kids can get angry, they can get, they have like a shorter temper, a shorter fuse, they can just not act themselves. And I think parents can get understandably frustrated. And I like to tell parents, like, this is the injury, this is not your child. Like, try to separate those things. I totally get it's hard. I have my own kids, totally understand this. But trying to separate those things and really understand that, like, you have to pull these two pieces apart. It is normal and it will get better. Don't forget, like, the brain heals for 1 to 2 years after injury. You still will see healing. You'll still see progress. So give your child time, right? You will still see evolution. And, you know, because of that, you have to separate what is worth getting upset about. Like, if it's dangerous, if they're hurting someone, obviously that's a different situation. But if they're just mouthing off at you, like, separate those things. Try to do your best to not get upset about that. I do have a lot of kids though that can get really depressed, right? Again, we talked about kind of pulling them out of their sports, pulling that, which sometimes can pull kids out of their social circles. I try to encourage kids, if possible, to keep going to their games, right? If you can continue to be a part of the team in a different format, that can help. But it's still different, right? You were a captain of the lacrosse team and now you're sitting on the sidelines. It's not the same. It's not the same dynamic, and that's hard. It's a hard pill to swallow, and it's hard to see past when you are whatever teen age, right? For kids that are still really struggling, we have a connection with sports therapists here. So for the athletes, really connecting them with some of the sports therapists who can help them work through these feelings, or just connecting them with a therapist in general. And it's really important to get them that help if they need it, and to really normalize that this is hard. This is not easy. And this is hard for the whole family.
Right.
This is hard for the parents. Watching your child go through this is hard. Take care of yourself. I say that a billion times a day. As a parent, it's really hard to go through this and watch your child. Your risk of post-traumatic stress as a patient going through this is the same as a parent watching your child go through this. So don't forget, you also are experiencing a trauma.
So this might be a topic for another day, but one of the things that I'm thinking about as we're having this conversation is there probably, I'm assuming, and you can tell me if I'm right or I'm wrong, there are undiagnosed TBIs or concussions, perhaps concussions that happen in a variety of different ways in life, to children, to adolescents, and to adults. How much work do you do after the fact, where people may be a month post or even longer post an injury and they've never received treatment? They didn't really change their lives. They wanted to get back to doing what they were doing. They didn't want to either admit, or whatever the case would be, that they had an injury and it was affecting them. What kinds of things happen, or what do we do, or what do you do and the team do for cases like that you might run into, that had an injury previous and missed out on the early opportunity for treatment and rehab?
I mean, I think that the hard part with that is, delaying taking care of yourself will prolong your symptoms. So that's the hardest part. So, encouraging kids to really take the time to modify these things, and the more you push and make your symptoms worse, the longer they're going to last.
Okay.
So taking the time to take care of yourself is important. I don't think we see it all that often. I think when people deny it, they continue to deny it through the course of their injury.
Okay.
However, I do think, yes, there is some denial that goes on with these injuries. There is risk that is involved with denial. We have people that get second symptom, the
Yes.
second impact syndrome. It's very rare, but it can happen, and the risk of a devastating injury because you didn't take care of and sit out because of that first injury is possible.
So Stephanie, what I'm hearing you say is if you suspect any chance that you suffered some kind of an injury of significance, please get evaluated.
Absolutely. And symptoms of concussion can take 24 to 48 hours to show up. So if you have a significant head injury, if you're in a soccer game and you collide head on with somebody while you're heading the ball, like that was a hard hit, sit out the rest of the game. Like, give yourself some time to decide whether you are getting symptoms. Don't just sit there and keep playing, because it can be really devastating.
And I would imagine coaches play a big role there in being able to maybe be able to take that player out of the game if they don't want to come out, or whatever the situation may be, and to perhaps I know there's been a lot of education with coaches and with schools at every level about how to recognize the potential of an injury and what to do when that happens.
Correct, there is. And there's a lot of there's a law in Massachusetts that all coaches have to have concussion education, before you're allowed to coach, so that you can recognize this stuff. So it's really important.
So that actually brings us kind of to our next and final question, or penultimate question is, let's talk about some hope. What are some exciting things that we're looking at as it pertains to TBI? Where do you think that research from physicians is going to add the most benefit? I guess the overall question is, what do we have to look forward to? What are we excited about in the field?
Yeah. So, one of the things that's really exciting, I think in the next couple of years, you're going to hear about more of, and I think we hear about a lot within the field right now, is biomarkers. So diagnosing concussion from blood tests is huge. So especially with kids that are in, like, say, a car accident, or when we have what we call pedestrian struck, so a kid on a bike that's hit by a car, or crossing a street and hit by a car, and say they suffer a tibia fracture, and sometimes we forget, right? They don't complain of a headache initially, and that kind of just gets pushed to the side. There's probably a lot of concussion that is missed in some of these more significant just overall injuries. But stuff like biomarkers can be really promising. And this test is, I think, going to really help kind of tease out some of these type of children that are currently being missed. I think the other thing is, ultimately, it will help decrease radiation exposure. It will help tease out who needs more significant testing and who doesn't. Right now, biomarkers exist. They still need a lot more research. The tests they're expensive. They're not widely available. They're not as quick as we want them to be. And they're not as predictive of severity as we want them to be. So, there's still more that needs to be done. But there's a lot of research going into it, and it's gonna get there, and it's gonna, I think, be, really life-changing for our field. I think, Dick touched on this a little earlier, but like looking into CTE and the discussions on long-term impacts of concussion. So some of our researchers here are involved with a study called the NFL Long Study, which looks at long-term outlooks from NFL players. And they just released kind of a piece of that study that actually showed that, let me see if I can get this right. So football players that had concussions, they looked at like how many concussions you had, but then also current like lifestyle factors. And it basically showed that like if you get like good sleep, if you have a good diet and you're exercising, it's actually more protective against anxiety and depression and mood issues then concussion is harmful to your health. So
Interesting.
you actually can kind of reverse some of these effects of your concussion by taking care of yourself. Like, go
It
take
is
care.
taking care of yourself.
Yeah, right? Like, that's awesome. So like, we're actually showing that, yeah, like you can get a lot of concussions, but like you can actually just kind of reverse some of those effects. It did show that you can't reverse all of the cognitive effects. So you can reverse some of them, but there are going to still be some like lingering cognitive effects. But I thought that was really cool. And that's a really interesting study that's, long term. We're going to give us a lot of information, because I think there's a lot of people that are jumping to conclusions about what all of this means. So these are a lot of cool things that are coming down the pipeline.
So the last question, oh, go ahead, Dylan, go ahead.
No worries. I think as a researcher myself, it just brings up a few things, that the sense that, I, of course, am not far along in my career yet to have self-directed research, but if I did, I also really want to look at how these injuries are affecting not only families, but kids emotionally. I think as somebody that really went through it emotionally after my injury, I want to understand like how kids are reacting emotionally to these really, in sometimes cases, brutal life changes that really uproot everything. I think there's so much to be done in understanding and supporting children as they go through this, not just on a clinical like way, but also in a, how can I help way? Not just a, how can I help your headache, but, how can I help the fact that you feel left out of everything type of help? Second, Stephanie, we talked about this a long time ago, but Stephanie started her career as a first responder, and I did too. And I think as a first responder, and speaking for EMTs and firefighters everywhere, if we were able to develop a pre-hospital test, kind of like a blood glucose monitor for a brain injury, it would be life-changing to say that I could take a little pinprick of a patient's blood and say, yes, we are positive on a brain injury or negative. And that's when we can say, we can advise the hospital. There's so much to do in that. And I think we can, take out so many, to Stephanie's point, like radiation exposures, inappropriate scans, like things that take time and money and energy to do, we can take out just by using this science. And I think there's so much to do in that way. And there's so much to do in all of this concussion and brain injury work. I'm personally really excited to see where we go in the next 10 years. If we've gone this far in 10 years, I'm excited to see what another 10 years brings us.
Yeah.
Well, that's amazing to hear, Dylan. Thank you for that message. And I want to thank Cornell University for helping educate you to a place where we can have this conversation, and you're so ahead of your time here with these insights and hopes for the future. Thank you very much. But I have one question for both of you. Yeah. If you each had the opportunity just to say one thing to a patient and a parent about brain injury, what would it be? And we'll go to Stephanie first, if that's okay.
So my one thing I think I tell most patients, and I tell most parents in the beginning, is this is a journey. It's a marathon. It is not a sprint. When your child is really sick in the ICU, like they're going to get better, right? I can't tell you where you're going to end up. This journey will change you. It will change your family. I think Dylan can speak to few people come out of this as the same person they went in, but we will get through this together. And some people love how they change through this, right? Like Dylan, you're not the only person I have that has really changed how they look at life, changed their sports, changed their career paths, and really changed how they view the world because of these injuries. But things will get better, and we're going to make it to the other side together. So hang in there, make this journey with me.
Yeah. I think my biggest piece, and it's a little bit related, is you're not alone. We, as fellow survivors, as fellow parents and families of survivors, as practitioners, everybody's going to walk with you. I mean, there's videos of me walking through the ICU with my mom on one arm and then nurse who was on my room on the other. And it's just a perfect example of the fact that, you know, you're not alone. No matter how far through the journey you are, there's always people that are going to be there to help talk to you, who are going to relate to you. I think people, especially for me, who are in college and still dealing with this, I love to be a resource to say, hey, like, you know, you can always call me if you're having a headache and we can figure something out. You can always call me if something's bothering you. We can figure something out. Brain injury affects a lot more people than you think it does, right? When I first kind of started to understand that I had subdural hematomas, I didn't even know what that was, but there are more people out there that are experiencing what you are than you think. And it's a sad fact, but it became very hopeful for me that I was not going to go through this alone, that people had done this before me and that I could follow in their footsteps, but I could also help them see things that they had never seen before. I think for any patient and family that's going through this, there is a survivor community out there for you. And there are people ready and willing and able to walk through this with you. So remember that you are not alone, that, you know, brain injury survivors, you know, we stick together. And to Stephanie's point, like, it's going to get better. It really will.
Thank you, Dylan. Thank you, Stephanie. I want to thank both of you for a fantastic conversation today. I know that we went on a lot longer than we were supposed to, but that's what happens when you get three chatty pants people together on a webinar, right? And I hope that people find it valuable. And just a heads up to folks, I hope that people will head to the Neuroscience Family Advisory Council's website, which was going to be linked below for any resources and information, questions you may want to have answered. And please stay tuned, because we'll be announcing more after the diagnosis episodes on more neuroscience topics. I want to thank everybody. And Stephanie, I can't let you go without saying that you probably need to buy tickets for Dylan and me to go to the BU Cornell hockey game next year in Madison Square Garden, because you may not know this, but BU kicked Cornell out of this year's NCAA hockey tournament in the quarterfinals. So we both have a grudge against.
Let's just do it together.
So let's go. Let's go to Madison Square Garden.
Yeah.
Peace, everybody. Peace.
Thank you so much.